The medicine of East Asia is based on a science that does not hold itself separate from the phenomena that it seeks to understand. Our medicine did not grow out of petri dish experimentation or double-blind studies. It arose from observing nature and our part in it. East Asian medicine evolves not from the examination of dead structures, but rather from living systems with their complex, mutually entangled interactions. Welcome to Qiological. I'm Michael Max, the host of this podcast that goes in depth on issues pertinent to practitioners and students of East Asian medicine. Dialogue and discussion have always been elemental to Chinese and other East Asian medicines. Listen into these conversations with experienced practitioners that go deep into how this ancient medicine is alive and unfolding in the modern clinic. These conversations come to you through the generous support of our sponsors and members. All the sponsors here provide helpful products or services that you'll find beneficial in your clinical work. Want to get better at treating concussions and other neurological conditions? Clayton Shu has some innovative methods. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. Later in the show, Jane offers you helpful suggestions on how to raise your rates, and Golden Flower Chinese Herbs shares a journey of healing that I think you'll recognize. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more. Ever found yourself listening to a Qiological conversation and thinking, wow, I needed to hear that? Yeah, me too. And I never know when I'm going to hear a guest say something that stops my world and reboots it with a larger perspective. If these conversations have ever helped you to feel more grounded, more inspired, or just less alone in this strange and wonderful work we do, consider becoming a member or supporting the podcast with a bit of tithing to the donation jar. It helps keep the lights on here at the Qiological Sound and Motion Lab so that we can bring you these conversations every Tuesday morning. You'll find all the details at qiological.com. Thanks for listening and for being a part of this.
Hey there. I'm Cameron Jafari, an acupuncturist from Los Angeles. So I started learning nanopuncture from Dr. Clayton Shu because I was facing these complex neurological conditions like stroke and MS in my clinic, and I just felt like I lacked a solid process to treat them. Brain-related issues always felt like a whole different animal, and I was looking for a clinical system that worked and could guide me through them. So after attending my first nanopuncture seminar, I was able to apply the process pretty quickly and with pretty amazing results. I remember the first stroke patient I saw afterwards was a guy who had had a stroke 2 years back and he couldn't talk at all. And after a few treatments, he started saying a few words. And a few treatments after that, he could actually have conversations. It was pretty incredible. So this is why I feel like nanopuncture is the future of acupuncture neurology. And you can be a part of that. Their next seminar is on treating concussions and is being co-taught by both Dr. Shu and Dr. Ayla Wolf in New York City on April 26th and 27th. To learn more, visit nanopunctureseminars.com.
People seek out our services because they're looking for some kind of a change. Usually, it's because they have something they don't want and they want to get rid of it. Although the opposite is also frequently true, they don't have something and they desire to get it. But something we might not think about is the nature of the change that our patients are seeking, or the process of change that they might already be in. Bianhua, the two-character Chinese word for change, can help to clue us in to the kind of change our patients are seeking. I'll be back a little later in the show to discuss how understanding the nature of change can help you with your clinical work. Hi, everybody. Welcome back to Qiological. Today, my guest is Farrar Duro. Farrar is an acupuncturist and herbalist in Florida. She has a specialty in treating women's health, and in particular, fertility and Polycystic Ovarian Syndrome, PCOS. She was recently on the Everyday Acupuncture podcast, episode number 75, which again is more for the general public. If you have patients that might have issues with these kinds of things like PCOS, you might want to have them listen to that podcast because there's some great information there. But today, we are going to get deep and geeky into how you can help your patients using some of the things that Farrar has discovered over the years. And also, we're going to talk about a new podcast a little later in the show as well. Farrar, welcome to Qiological.
Thank you. Thank you for having me.
I'm so excited to be having this conversation with you because after we did that show for Everyday Acupuncture podcast, I had some new ideas about looking at and thinking about polycystic ovarian syndrome. And it's been helping me in clinic because there are some patients that I've had that previously I wouldn't have really thought, oh, maybe she's got PCOS. But now I'm starting to think about the possibilities. And the kid, I just saw a kid recently, she's 16. Can I say that's a kid? Feels like a kid to me. And it was so helpful because now I'm thinking about things that I can do that might help her years down the road.
Yeah, I just think that you just changed her whole life trajectory basically just by identifying that. And, probably she had no idea, no clue what was going on. And I could also imagine her mother, too, being very relieved to have a few answers. So that's great.
Yeah, it was a little surprising for them to hear that since I'm not a gynecologist. And, usually these are the kinds of discussions that women have with their gynos. And so it's kind of unusual to, be an acupuncturist and be able to help women like this.
Yeah, I think we have a tremendous opportunity because we do spend more time with our patients on a whole. We'll be able to glance into their whole menstrual history just by asking our detailed questions about the cycle like we do and all the things that we want to know. They might not have ever been asked that before by their gynecologist or anyone.
Exactly. It's kind of interesting. Well, let's start in with your journey into this. As I recall, you sort of found your way to Chinese medicine due to a flying pack of birth control pills coming at you.
Yeah, that was definitely the good fortune that I had, and I'm really thankful for that day. Honestly, growing up in Alabama, I grew up in a really small town, and we had one red light, and I actually lived down the street from an herbalist. So it was actually a husband and wife. They had a small herbal health food store. And I remember being 12 years old and just walking over to down a dirt road to this health food store and just being surrounded by all these herbs. And I was just fascinated. So I knew at an early age that there definitely was a beauty in natural medicine. And I would just pick up books and learn as much as I could. So they really did teach me a lot, and basically just making my own acne tinctures out of rosemary and things like that. So I was kind of that weird kid growing up, like going, okay, I'm definitely different. I know that, but I really, really love plant-based medicine. So when that happened, I just knew. I said, you know what, there's definitely an opportunity here. I could get really upset and I could just give up, or I could start looking for answers. So that really turned me more towards Eastern medicine.
Yeah, you needed to scratch your own itch on that one.
Right. And I knew that other women and other girls, I mean, I was 19 when it happened. So I knew that other girls were suffering too. I just, thought, well, there has to be something to this. Like, I can't be the only one.
Yeah. So off to Chinese medicine you went.
Right. I was actually going the pre-med route, and I did a research paper on acupuncture and addiction for a psychology class I was taking. And I said, wow, this makes so much more sense, actually. And I had never had acupuncture before. I didn't even know an acupuncturist because in Alabama, it's still not regulated. So I just basically said, that's it for me. I'm going to Florida and I'm studying Chinese medicine and I'm going to heal myself and get better. So that's what happened.
Awesome. Let's dive into some of this stuff. What I'd like to do is begin with kind of the Western point of view. I know for myself, patients often come in and they're often well versed in their Western diagnosis, in the various symptoms, in the various treatments, that kind of thing. We're going to get deep into the Chinese medicine piece here in a moment. But let's begin with just what is polycystic ovarian syndrome?
Sure. It's a hormonal disorder, and it is common among women of reproductive age. It's pretty common, pretty underdiagnosed, I might add. And most of the time, women with PCOS are going to have pretty infrequent or perhaps prolonged menstrual periods, and also excess male hormone levels or androgen levels. Also, the ovaries might develop numerous small collections of fluid, or they say, they could be called follicles. And basically those fluid-filled cysts or follicles just don't release like they would normally for someone who is ovulating every month. They kind of collect around the ovaries, and that's what makes them appear pearl-like, or they have a cystic-like appearance on an ultrasound. So this is usually diagnosed by a medical doctor during an examination, or sometimes just looking at blood work. If the testosterone levels are elevated, or DHEA, looking at that, and then also seeing, well, the period is irregular. That's another hallmark. So you really just need 2 out of 3 things to be true in order to get a PCOS diagnosis now. And basically that's irregular periods, high levels of male hormones, and also polycystic ovaries. So if 2 out of 3 appear, then that is usually a PCOS diagnosis.
Okay, so those are the main things that we're looking at here for that diagnosis. What are the main treatments that our patients might have already undergone in an attempt to correct this problem?
A lot of women come to us that have been on birth control for many, many years, and that's just basically an attempt to control a cycle or to produce an artificial period and keep all the symptoms at bay, perhaps like acne and mood swings and that sort of thing. And it's really more of a Band-Aid approach. So that is one of the most common approaches. Also diabetes medications, because PCOS is a pre-diabetic like condition. So they use glucophage or metformin to help with controlling insulin resistance. And it's basically then we go into the fertility treatments, which would be using clomiphene or Clomid or Farrar or IVF as well. Just medications to help a woman ovulate, and the lack of ovulation is usually the reason for fertility problems in women with PCOS.
All right. You mentioned that metformin is often used. So this is sort of a pre-diabetic or a metabolic syndrome type thing. In Chinese medicine, I think we'd probably talk about that as a spleen condition. Does that cotton for you? Does that make sense?
Right. I believe that over years and years of treating PCOS, it's really a complicated pattern in Eastern and Western medicine. So sometimes that makes it so much harder to treat. Most of the time, I think in young girls, it might present as liver qi stagnation with a little bit of spleen qi deficiency. But over time, that becomes more kidney spleen yang deficiency, and also a little bit of blood stasis as well. So if you can catch it early in the liver qi stagnation phase, that's wonderful, because you are going to be actually getting faster results. But as time goes by, it does start to affect the kidney, the liver, and the spleen.
Let's talk about this a little bit. Let's talk about a young woman maybe just started menstruating, and her period, it's been difficult, maybe from the get-go. How would you begin to treat that? And do you have any case studies that you might be able to share with us about that would give us a glimpse into your thinking on this matter?
Sure. Yeah. I mean, definitely we're looking at Chong and Ren disharmonies. I use a lot of extraordinary vessel treatment, and I believe I took a course from Jeffrey Yuen several years ago when I graduated from school, and it really was just eye-opening. It was actually an extraordinary vessel infertility course, but I use that in my practice ever since, and I just find that with so many disorders involving the reproductive channel, we need to get deeper into those channels. And so I definitely start with that. I using Ren and Chong channels and also spleen, liver, kidney channels as well. What I've seen that with, I guess you could say in my case, my cycles were very spread out. Sometimes I wouldn't get a cycle for 60 to 90 days. And with some of the patients I treat, they've never really had a regular cycle or a cycle without being induced with Provera or certain medications. So we really do need to create a cycle almost. I mean, we need to help the body start to ovulate again so that the period will come on its own without being forced.
Mm-hmm. And so you find the 8 extras have been helpful for this?
Extremely helpful, right? And getting back to how I guess I was treated in the clinic when I was in school, I actually started taking Xiao San. I went to China to study there and had my pulse read by a really old pulse diagnosis master, and he said, "You're going to need to take this for about 5 years." And so he actually was right. I took it for off and on for about 5 or 6 years. And that very formula actually helped me get pregnant with my son and my daughter. The same bottle, actually, which was really funny, Jiaowei Xiaoyao San. Mm-hmm. So because it's basically being caught a little early. But with our patients, we do combine the extraordinary vessel treatments with a 4-phase formula approach, similar to Blossom by Evergreen Herbs, which I really like that composition. It's easy for patients to take because it's in capsule form. And I like it because it does address the kidney at such a deep level. And it also helps them create a pattern where, to balance the estrogen progesterone levels and also really work on the LH surge and things like that from a natural perspective. So we've had a lot of Blossom babies. So Evergreen, thank you very much for that formula. It's beautiful in the way that it's constructed. And, not only that, but we use that formula series, phases 1 through 4, as a start, but also we use it basically a tea that we can customize to the patient along with the Blossom formula. So it's been really helpful.
What is in that Blossom formula?
Well, phase 1 starts with moving blood. So basically, if someone has not had a period in several months, we're really looking at starting with phase 1.
Can you back up just a moment and tell us about the phases then?
Sure. Well, the overview is basically that you have 4 phases, and Blossom phase 1 would be starting on day 1 of your cycle, which would be, if you're having cycles, it would be the first day of full flow. So you're typically, and based on a 28-day cycle, you're going to move through each phase once per week. So basically, phase 1 would be week 1, phase 2 would be week 2, and et cetera, phase 3. Week 3 and phase 4, week 4. And so looking at what is going on there, when we look at the cycle, it's a little bit more complicated when we're working with fertility as opposed to let's just relieve some of the symptoms and that sort of thing. So if we're looking at phase 2, what that does is nourish kidney yin. And that's important to help follicular growth, especially if they've just been sitting there dormant. And for probably years. I mean, perhaps some patients haven't ovulated for years. So if we're looking at that, what does phase 2 do? The importance of that, it's nourishing kidney yin. And the basis of that formula is a kidney yin, similar to Lu Wei Di Huang Wan, that sort of thing. And then phase 3 would be the ovulatory formula, and that's more kidney yang tonification. So that's really important as well. And phase 4 focuses on moving liver qi. So that's really the luteal phase formula as far as the Blossom formulas go.
Right.
So sometimes it depends on what we're feeling in the pulse and the tongue. We might stay on phase 4 for a while if there's a lot of liver qi coming up, and couple that with the constitutional formula.
I see. Getting back for just a moment to the 8 extras. Do you use the coupled points as a way of working with them, or are you more of looking at the trajectory of those channels and finding points relevant on the trajectory?
So a lot of times my treatment, I mean, I guess like with all of us, it will change according to what you're seeing with the tongue and the pulse and also palpation. And I do Mayan abdominal therapy as well. So I kind of mix the two. I do acupuncture and Mayan abdominal therapy in one visit. And that is helped because that is abdominal work to check for also stasis or any pain along the stomach 30 line or around RIN 3, RIN 4, and doing some manual treatment as well on the sacrum and all those great UV 31 through 34 points, and alignment of the hips. So just, really doing a lot of palpation. If I see that there is some stasis in the lower abdominal area, which happens a lot because it is some congestion going on, perhaps the lymph nodes in the inguinal area are congested, then I'm actually going to needle stomach 30, stomach 29, RIN 3, RIN 4, and then also with the opening points as well.
This episode is brought to you by Jane, the clinic management software that I use to keep my practice running smoothly. So, let's talk about something that can be a little bit uncomfortable, raising your fees. I know, this is something that might feel awkward, but it doesn't have to. With a bit of planning and care, you can handle it in a way that feels right for you and your patients. One tip, give yourself at least 2 months to prepare. This gives you time to get comfortable with the change and let your patients know what's happening. You can share the news through emails, booking reminders, or even just a friendly little sign in your clinic, and avoid over-apologizing. Instead, keep it straightforward and matter of fact. Keeping things consistent across the ways that you communicate can really help avoid confusion. Fee increases aren't always easy, but you're not on your own here. For more tips and ideas on how to communicate these changes with confidence, check out frontdesk.jane.app and look for the article, How to Tell Your Clients You're Raising Your Fees. Oh, and one last thing, if you're ready to give Jane a try, use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. So you're palpating for areas of stagnation and then looking to release those.
Right. And I mean, sometimes if somebody hasn't had their period for a long time, they are going to have soreness around the ovaries. And just because a lot of times with PCOS, they have enlarged ovaries. So it's just something that makes a lot of sense to us. We're saying, okay, they're stuck, I mean, it's definitely some congestion going on. So using a little heat there is fabulous. It feels so nice a lot of times when they are getting that combination approach. Even if you're not doing a Mayan abdominal treatment, you're doing at least a little bit of work, perhaps some massage around even, RIN 12 and that sort of thing. That's also really helpful. And castor oil heat packs are just a heat lamp there as well. Yeah. And Moxa.
Lovely Moxa. Mm-hmm. You mentioned the blood sugar thing, and I want to get into that here in just a moment. But before I do, you also talked about that on an ultrasound, you'll often see these fluid-filled sort of vesicles. These are the cysts that are sort of the cyst of polyovarian syndrome. In treating these fluid-filled cysts, I'm wondering what you're thinking about here. I mean, when I hear that from you, my first thought goes to, there might be some sort of fluid metabolism issue here that I need to pay attention to. I'm wondering what your thoughts are on that.
I mean, 9 times out of 10, I see it as phlegm and blood stagnation. So it's not, I think the phlegm might be overemphasized a little bit with PCOS. And it's because sometimes we see, okay, the tongue is a little swollen. But the biggest thing is blood stasis, because when that period actually comes, it's not going to be pleasant a lot of times. It is going to be pretty dark. It can be cloudy. So behind that is the blood stasis. And also you can have a period that lasts forever. So if somebody hasn't had their period in a year and then all of a sudden you're actually helping, I'm not saying inducing the period, but you are helping that period to arrive, then it can be quite uncomfortable. And sometimes it lasts for 10, 15 days. So we have to look at it as there's some work to do with the spleen. And sometimes just focusing on damp is not exactly accurate, I don't think, in my opinion. I mean, as far as what would be the most effective. I rarely use phlegm type herbs with PCOS, so it might be a little bit unusual in that aspect, but I do like to focus on blood moving herbs.
Okay. Helpful to know. Let's go a little bit into this thing of blood sugar and its relationship to PCOS and more importantly, how we deal with it as Chinese medicine practitioners.
Right. I mean, definitely the spleen plays a role. And the first thing that we say is, you know what, we're going to have to back off on dairy and the white foods like pastries and refined carbs. So just looking at the weight in general, sometimes there's a problem with obesity or weight gain. That actually does help, obviously, because you're eliminating sugar and dairy. But what we're also trying to do is help the spleen work better. So if we're focusing on the spleen yang deficiency underlying everything and, really helping with the insulin imbalances, sometimes that just falls in place when we're actually working a little bit on like incorporating a spleen chi diet and spleen strengthening foods like our root vegetables and things like that. So it's so important. I think that we've got some wonderful tools using Chinese medicine food therapy. I mean, it's excellent. So even if you're just doing one thing, it's basically telling them, please just back off dairy. And that makes a huge difference.
Mm-hmm. That would really address the phlegm aspect too.
Phlegm, yeah, and helping the spleen work a little better, definitely. And now there's some theory about perhaps PCOS might be related to the Epstein-Barr virus, which they say kind of feeds off, eggs, dairy, these sort of things. So whatever the cause of it, we know that our treatment works. I mean, it's just time tested and we have amazing tools. So if we stay focused on what the spleen is doing in Chinese medicine, it's really not transforming very well if there are some insulin imbalances and some blood sugar issues. And also if, there's a lot of fatigue going on a lot of times, they'll say, I'm just so tired. And even if I sleep, I still wake up exhausted. Well, then we see a lot of patients with PCOS have thyroid issues. So, we look at the thyroid as, well, it's part of our endocrine system. And also the kidney is probably not working as well as it should either. So.
Okay. And you can speak here from both the Western and or Chinese medicine point of view on this one. I'm curious to know, how is it that sugar and insulin levels seem to drive this thing? Right.
Well, I mean, you could look at it as insulin can help, it can affect so many other things. So it can drive other hormonal levels. So if our pancreas is not working well and we're actually secreting too much insulin, it can be stored as fat, and the fat in turn actually causes our estrogen to rise. And so all that excess estrogen is just driving up all the other symptoms in the body. And then along with it, you have lovely testosterone that's actually brewing and getting higher. So it actually manifests with a lot of irritability. It could be acne, hair loss, abnormal hair growth. There's just so many things happening. And then obviously infertility and diabetes and heart disease on down the road, because you've just got all that unopposed estrogen we don't want to talk about, but it could be that breast cancer is one of those things that we look at. And if we could prevent all of that, I just think that we have such an opportunity in front of us to do this. I mean, PCOS is not just a reproductive disorder. You can take out your ovaries and you can still have PCOS.
That's interesting. Tell us more about that.
Right. I mean, it affects everything. So if we just say, let's just pretend that, it just is an ovarian disorder. And a long time ago, they were actually doing some sort of drilling technique where they would remove some of the ovary or that sort of thing. It's still, I mean, you still have all the symptoms as well. I mean, you actually cannot just isolate one thing and say, we're just going to remove the ovaries, because even women who actually are in menopause, they still have this quality of PCOS. So perhaps it manifests as high cholesterol or they could also have a higher risk of diabetes still. So, and most of the time, there is some history of diabetes in the family. So, for instance, my father has type 2 diabetes. There is a higher incidence of my children or my daughter having PCOS because I had it. So there's many different things going on. But if you look at family history, then you can tell them, guess what? We have a chance right now to help prevent this from happening in the future. And this is not just something to do with your ovaries. This is your mental well-being as well. There's anxiety and depression that come with PCOS. So many things that we can address and we can really make a difference with.
Yeah. If I'm following you correctly here, then there could be issues that some women are having, especially later in life, right? Diabetes, heart disease, these kinds of things. And perhaps the underlying reason is PCOS.
Right. And I think that that's not paid attention to as much because, you're over 50, you're not wanting to get pregnant. So a lot of the doctors are actually not looking at PCOS anymore after a certain age, but it's still PCOS, and it's a lot of times not being addressed. So what happens is, they're on hormone replacement therapy and then also getting taken off of it. And then everything starts to go haywire. Wow, the cholesterol's going up, hypertension. All of a sudden I'm gaining all this weight and I can't seem to lose weight. My thyroid's out of control. So we see these things every single day. And we say, God, I wish we could rewind a little bit and really treat the root cause. Now we're going to do that, but it's not going to be a short process. It's going to take a little while.
Time for a little break here, and I want to share with you some brilliance that I gleaned from Sabine Wilm's new book, Humming with Elephants. It's chapter 5 from the Suen, and it's about the resonant manifestations of yin and yang. In the book, she points out that while in modern Chinese, the two characters, bianhua, mean change in a sort of generic way, each of the characters separately, though, speaks to a different kind of change. Bian is more of a step-by-step incremental change, whereas hua is a transformation that profoundly and irreversibly changes something. So, for example, a rainstorm would be a bian type change, while a typhoon that blows your house down, that's hua. Slowly stiffening arthritic joints, that's bian. A cancer diagnosis, well, now you're looking at hua. It's helpful to keep these distinctions in mind, as your patients might be in the midst of a hua-type change, but they were really hoping for more of a bian. Likewise, they might not want the step-by-step incremental nature of a bian-type change when the transformative hua is what they're after. So the next time a patient comes in looking for, I'm using quotes here, change, see if you can differentiate what kind they're looking for. Is it bian or is it hua? And now let's get into the second half of the show. Can you give us an example? When we talked earlier about a younger woman and you would often use the blood moving formulas, what about a woman who's more middle age, maybe even getting close to menopause? How would you approach helping somebody in that situation?
Right. With all the kidney yin deficiency that we see a lot of times, it's just coupled with liver fire at that point because they're a bit frustrated. After all these years, nothing's really changed much. Things seem to be getting worse. And PMS is one of those things that actually can manifest and get worse with age, unfortunately. So if we don't address it, we need to look at what happened with that liver qi stagnation. Is it now turning into fibrocystic breast, or are we having issues with our relationships, and how is it manifesting, and what are we frustrated with? Because it comes through a lot. We see so many different things happening at that particular point, where it should be a point where, you're receiving all this wisdom and you're actually able to be more comfortable in your skin, and that's not happening. So there's definitely an imbalance and a disconnect going on.
Yeah. What are some of the surprising things that you've learned about treating PCOS over these years?
Never say never. That's one thing. And I remember just being terrified when I had my first patient with PCOS. And I was actually working at a fertility clinic, and she came in with one ovary, with polycystic ovarian syndrome, with a blood clotting disorder, with a rod in her spine, and also a fibroid. So I said, I don't know. And she also had a history of 3 miscarriages. So I said, I'm really not sure if I can help you. And she actually only ovulated every 3 or 4 times a year. So she only had a few cycles to work with, and she really wanted to get pregnant. So I was terrified. Honestly, I was trying to research every single thing I could. I told her I really wasn't sure if I could help her. So long story short, after about 4 or 5 months of working together, she said, I don't really know if I can do this anymore. And of course, that was a month she got pregnant. Basically, I was using formulas and acupuncture and all kinds of stuff. So I called her doctor that she was working with, and I said, I think that, she's going to need some testing because she's pregnant. She had several miscarriages. Sure enough, she had a blood clotting disorder that had not been treated. So we used Chinese medicine in addition to heparin. And heparin is actually not used as much. Now they use Lovenox, but it's a blood thinning medication. And in her case, it saved her pregnancy. So up until then, and obviously I took her off herbs at that point, but, really, I had just thought, wow, not only did she only have one ovary, but she only had one fallopian tube, and the fallopian tube was on the opposite side of the ovary. So that little fallopian tube had reached over, had grabbed that egg from the polycystic ovary, and actually had, resulted in a pregnancy. So I said, okay, after this, I will never say never. I cannot imagine a more difficult case, but she had a healthy girl and it was great.
Wow.
So
it's kind of fun to do the impossible, isn't it?
Yeah, it's really tremendous. And of course, that was her only child. She said, I think I'm done after this. But I actually think she had 3 miscarriages before that because the blood clotting disorder was not diagnosed until the last pregnancy. But I think that we can work with and reach out to the gynecologist and to the IVF doctors and say, you know what, we're doing these particular treatments, and it's really important if you have somebody with a history of loss, because you will see that too with PCOS, is that there could be some history of miscarriage, because over time, the elevated testosterone can damage egg quality. And so the eggs suffer. I mean, they're sitting there, but they're not, when that happens, sometimes the egg quality is not so good. So you can have a higher rate of miscarriage with Clomid as well. So reaching out, making sure that they're taken care of is really important. And all the tools that we have, I still use extraordinary vessel treatment during the first trimester as well. It's really, I think, really beneficial.
Yeah. It sounds challenging. I mean, not just from the technical perspectives of how do we diagnose this and treat it, but as you mentioned, especially for women, more in mid-age, it's a long haul. And it's often tough for patients to recognize progress as they're moving along. We sometimes see progress for them, but it's hard for them, right? You had this patient who said, I don't know if I can keep doing this. I'm wondering if you have any thoughts or ideas or ways you have of working with patients when you know it's a long haul. How do you help them recognize the milestones that they've passed? How do you help them recognize that something's actually changing, and that change is a movement in the right direction, to keep them motivated and continuing with moving forward with getting better?
Yeah, that's a really good question, because we have to always find out what is the main reason that they're coming to us. Is it because they are trying to get pregnant, which is going to be probably a longer treatment, perhaps, or is it because they just want to regulate their cycles, or they just want to come off birth control? So what's the goal? And if the goal is fertility, then obviously it's going to be a longer treatment. And sometimes it's combined with Western medicine. So we're working with fertility drugs as well. But, I'm always very honest and open, saying this is a chronic condition, and we can only really do so much in the time that we have. So if we have 3 to 6 months to really help maximize what your hormones can do and what your body can do, that is optimal. If we don't have that long, then we might not get all of the things accomplished that we want to get accomplished, but we're going to try.
Imagine this. A patient walks into your clinic. They're carrying more than the pain in their body. There's a story there, a history, woven with the stress of long days, the ache of things unsaid, and the quiet longing for something to shift. You listen, not just with your ears, but with your hands, your intuition, your heart. It's not just about needles or a formula. It's about connection, understanding the threads that tie us together, mind, body, and spirit. That is where golden flower Chinese herbs comes in. Rooted in tradition and crafted with care, their formulas are more than herbs. They're a bridge between ancient wisdom and modern practice. Every bottle, a quiet partner in your work, helping you to meet your patients where they are. Because healing isn't just about treating symptoms. It's about creating trust, cultivating belonging, and helping someone feel truly seen. Golden Flower Chinese Herbs, your partner in practice and connection, where tradition meets care. Mm-hmm. For let's say younger women who they're not looking to get pregnant, they just want to fix their period. They just want to feel better, maybe get rid of the acne, some of the various things that go along with this. What kind of time frame are we often looking at? And what kinds of treatments seem to help those women?
I think that if someone is coming in, for instance, we have 14 and 15-year-old girls that come in and their mom says, I just don't want to put them on birth control, but they just are not having regular cycles. What can we do? I do like to start with a basic formula, like it could be suatong or shaoyasan, that sort of thing, or even adding Vitex, because that is something that actually I find they're very compliant with. If they're feeling better, they'll take it. And, and there's that motivation there. And sometimes they're some of my best patients because they really understand, like, oh yeah, I'm not supposed to eat that, or I have to do this because if I don't feel good and I want to get better. So we do have them also keep a journal, and we can see that some of the pattern is, okay, these symptoms are coming around when my period should be coming on. So, and then they actually regulate their cycles pretty quickly and most of the time. I mean, I'm just so amazed at that. And so if we can address it at that point, that's really great. And sometimes I bring it up to some of our patients and say, oh yeah, I do treat, younger girls as well. And they're like, oh, well, my cousin's having this issue, or my daughter, I didn't even know that this was out there and this could help. So it's not going to happen sometimes unless you mention it and you talk about it more.
I mentioned earlier in the show that because of our first discussion on the other podcast show, I've started to clue into some things in my clinical practice that I would have not noticed previously. So for our listeners out here, the other practitioners, what is it that we might be overlooking that actually could be PCOS?
Well, number one is always ask, when was your last period? And most of those questions are on our intake forms. But if you notice that they're not sure, or they can't remember because it's been so long, or maybe they've been on birth control, but it's not for contraception, they were placed on it, but they really didn't know why. Because a lot of times it wasn't ever explained to them. Just here, take this. So that could be a clue of like, what was your cycle like before you started birth control? And they have to really think about that sometimes. So number one, cycle irregularity is one of the biggest clues. And then if you do see somebody that has perhaps a little bit of abnormal facial hair, or they are getting a little bit of darkness around the skin folds, that's usually an insulin imbalance too, the discoloration of the skin, I'd say in the neck and underneath the arms. And when you're doing your points, you can see that. And also, just in general, they're complaining to you that they are not healthy. They just don't feel good as far as, they just can never seem to lose weight and that sort of thing. A lot of times you will see women who have PCOS, they're thin. So it's not always going to affect, but a lot of times they have to, they still struggle with some of the same issues. It's just that they're not gaining weight as fast as other women who have some more, more pronounced insulin imbalances.
Mm-hmm. Okay. Often I have women who have migraines that cycle around their period. Does this relate to that in any way?
I mean, we do see that a lot with endometriosis, actually. So I know we're not talking about that, but I have seen a big correlation with endometriosis and premenstrual migraines. And I just feel like that's that blood stagnation issue coming right back.
Mm-hmm.
And when we address it at the root, it just seems to kind of go away. And you go, well, come to think about it, it really hasn't been happening anymore. So when you start working with the liver and the spleen channels, I think it's just part of our treatment. I also like the Ton balance method, it actually uses some points that I believe, I'm not sure the name of it exactly, but it does have a lot of spleen, stomach, large intestine sort of balance points in there. So there's automatically points added for migraines and headaches and that sort of thing. And that is one of the best treatments, I think, for menstrual pain in general. And we get really good results because sometimes with PCOS, you also have coexisting endometriosis.
Makes it a little bit more complicated.
Right.
Yeah. We're going to talk about your podcast in a moment because that's a great resource. But before we do, I'd like to see if there's any other resources, books or websites or just things out there that other practitioners could avail themselves of to learn more about how to treat their patients that have this condition.
Well, I think it's a great idea for anyone who is working with women who have cycle irregularities or infertility to read the classic Toni Weschler, Taking Charge of Your Fertility. It's one of my favorite books because it makes it so much easier to explain to patients that if they are charting their temperatures, which is one of the things you can do for PCOS that we didn't talk about, but it's free and they can actually see if they're ovulating. So when they do it correctly, when they take the temperature in the morning, they start to see a pattern. And you can actually just print out one of those charts from her website. She actually has really good references in that book too. And you can teach them how to chart their cycles. And it's just really important for them to actually be able to see on paper. We've actually had patients who have PCOS who found out they were pregnant that way many, many times because one of the most frustrating things is not knowing when your period is going to be coming. So it could be that you are pregnant and not knowing that's actually happened. So if you do chart your temperatures, you can see a shift when you ovulate, and you'll see the temperatures actually just shoot up and stay high. So we can actually see that that's happening for, let's say, if the temperatures are higher for more than 16 to 17 days, we should probably be asking that patient to take a pregnancy test and then referring them to a gynecologist, because at that point they probably are pregnant. I mean, 9 times out of 10. So that book is really a must read. And also I did write a guide a couple years back as well that's on my website too. And it's really it was written for my patients, and then I just decided to put it out on Amazon because it was something that they could use as a reference, and anybody who's undergoing fertility treatment or thinking about it or also working with an acupuncturist, there's a ton of research in there that was put together by the Arboretum, and a lot of good information for anybody going through fertility treatment, and also some information on charting your temperatures in there as well.
I've had patients, some of them very compliant with charting their temperatures, and some of them just not so good. Lately, I've heard about thermometers that actually hook up to your smartphone and chart this stuff. Are you familiar with any of these?
Yeah, a lot of the patients will use apps, and there are pros and cons to it. I've had people have their history erased, and that's really frustrating. So I'm kind of old school with the charting. I still like the paper version. I think it's great to actually bring to your practitioner and say, oh, this is what's going on. Because when we have to flip through a phone, the screen gets cut off, and then where's the first day? It's actually more confusing for me to look like that. So rather, if they could just keep the piece of paper by their bed, they can actually save the temperatures in the thermometer. And we're not asking them to do this forever. I tell them at least like 2 to 3 months. And also on the chart that we have, I think on the latest version of the Take Charge of Your Fertility chart, there's a section for acupuncture. So they can actually check off when they got treated, also what herbs they took, when they had intercourse, many things like that. So they can really just can get a whole glimpse of what their symptoms are. So it gives us a ton of information. If we're seeing a lot of low temperatures and nothing happening, it's just flatline, then nothing's going on. The ovulation is not happening. Probably the adrenals are shot. There's many things going on. The kidney is not working as well as it should. So it gives us so much information. And if they're able to do that, it's really great. And it could be frustrating sometimes when they're not seeing much change, but we tell them, look, you know what, it's actually going to reveal to us a whole lot. Maybe we need to modify your herbs. Maybe we need to work integratively. So there's a lot of information we can glean from it.
Yeah, I can see how it would be helpful too in giving them a glimpse over a period of time what kind of progress they've actually made.
And they'll keep the charts. I mean, I've had patients bring them in. And in fact, this past week, this was actually someone who had hypothalamic amenorrhea because she had an eating disorder. And so she didn't have a period for years. With Chinese medicine, actually, she was able to get pregnant naturally. She had, within 2 months, she had a period and actually had a healthy pregnancy. So it was wonderful. And then came back for baby number 2. Within 2 months of taking Blossom, again, I love that formula, she was pregnant again, and her temperatures were sky high. They were just looking great. And she went to her doctor, and they said, well, let's see, let's check your hormone levels. Her HCG, pregnancy hormone level, did not come back very high. So the doctor was very concerned and said, I'm not sure if this is going to be a viable pregnancy. So that was terrifying for her. And she said, but I don't understand. When I tell you her pulse was amazing, it just felt beautiful and slippery, perfect. So I was as confused as she was. So they actually told her that she'll probably have to terminate because it might be a tubal pregnancy. Long story short, she goes back for the ultrasound. There is a healthy, viable embryo there. The levels are perfect. There's nothing wrong. What I don't understand is sometimes, we can look at things and say, okay, she's still charting her temperatures. The temperatures were beautiful. Had she listened to that advice and basically just gone in and said, okay, she would have actually ended up terminating her pregnancy, which I think is just pretty crazy. So if we're looking at a number, that's one thing. But if we look at the whole picture and everything that we do, it's just so powerful. So if we can, use all the tools we have, the pulse, she was actually taking herbs, things like that, we're actually going to benefit our patients so much.
Yeah, it's often very useful to them to have more data points than just a Western test. I mean, those Western tests can obviously be very, very helpful. But like you were just saying, there's other things that we can see that can point out, hey, this person's actually doing pretty good. Keep going.
Right. And I mean, we can encourage them too and have, say, let's just, keep charting a little bit. They can keep charting until maybe even the second week into the pregnancy if they want to. There's usually not much reason to continue after that, but sometimes they just like seeing that. It's reassuring. Like, okay, when the temperature plummets, the period is usually inevitably coming, but when the temperatures keep climbing like that, that's usually a pregnancy, and you could see it as a triphasic climb. So it's great to affirm it. Also, someone with PCOS who doesn't have regular cycles, they don't have to take pregnancy tests every single day and just drive themselves bonkers, because it's so frustrating to, for one, spend the money on pregnancy tests and keep having to do it. And instead, just glancing at the temperatures and saying, wow, I ovulated. That's great. Maybe it took them 2 months to ovulate, but they ovulated. And, we can count 14 days from the day of ovulation. That's usually when the period's going to come. So it really does help a lot with the anxiety too.
Yeah. Tell us a little bit about your podcast.
Yeah, it's something that I just have been very excited to do because I really wanted to bring in other practitioners, other resources for women who are struggling with PCOS. And I wanted to reach women all over the world. So that's really the only way I could think of that would be the most effective way that everybody could actually listen in and really get this information. And I guess it was probably coming from, growing up in a place where there wasn't a whole lot of resources. We're really fortunate. Where I am now, I'm in a big city where there's a ton of resources and acupuncturists and herbalists and all kinds of things, but not everybody has that. So this is something that I started it's been exactly 1 week. So it hasn't been that long. And it's just been really exciting to bring on people that have so much knowledge. We have reproductive endocrinologists, we have gynecologists, psychologists, and actually, women suffering from PCOS that were able to overcome it naturally. Yeah, so just all kinds of resources. So, and actually all the podcasts are at PCOSpodcast.com. So I'm going to also include a practitioner section as well, and some helpful links for practitioners to give things to their patients as well. So
terrific.
I'm really excited. Yeah, thank you.
Well, I will put all of this on the show notes page. So those of you listening, you find this and just head on over to the show notes page. There'll be links to everything. Farrar, is there anything else that you'd like to share with us before we wind this down for the day?
No, I'm just really excited to talk about this because I feel like as acupuncturists, we have such an opportunity to help all these women, and just really getting the word out that this is something we can treat. We don't have to be afraid to work with this, and you'll just be giving them so much relief probably throughout their lives. They'll be able to learn how to manage something that really was insurmountable to them before.
Yeah. And like you were saying earlier, completely change the trajectory of their life.
Right. Even perhaps affecting future generations. That's what I really think that this treatment does.
Wonderful. Well, good luck with the new podcast, and thanks for being on the show.
Thank you so much for having me.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.